And tonight, CBS 4 is hosting a live group discussion with a panel of doctors on the pandemic in South Florida. Here is the panel with us tonight. FIU infectious disease specialist Dr. Aileen Marty, president of Nicklaus Children's Pediatric specialist Dr. Perlyn, and Dr. Yvonne Johnson, the chief medical officer at Baptist Health South Miami Hospital. Thank you all so much for joining us tonight. Let's kick things off with the CDC's latest guidance for pregnant women and the vaccine. A lot of misinformation, unfortunately, out there regarding the vaccine has centered on fertility, and it has likely hindered some women of childbearing age from wanting to get that shot right away. Dr. Marty, let's begin with you. What does the research show about the vaccine in pregnant women?
The research shows very clearly when you compare pregnant women, and there have been tens of thousands that have received the vaccine, their pregnancy outcomes and their health and that of their child compared to women before we had the pandemic who were pregnant, they fared as well or better as women who had not had the vaccine and the pandemic had not been released. That means that the vaccine did not in any way increase any risks to the pregnant women or to the child. In comparison, pregnant women who are not vaccinated and who get COVID are at high risk of a lot of complications for themselves and for their child.
Dr. Marty, thank you. Now, this next question is for Dr. Johnson. It seems that somehow this misinformation that we're hearing a lot of has actually even infected hospitals. We're hearing that a lot of the staff at some of these major health groups here in South Florida have not actually been vaccinated themselves. So how does that happen? How are these mixed messages going into the hospitals, and how does that sort of hinder the way that we're able to help patients, or that you all are able to help patients, when some of the staff there at the hospital themselves are not vaccinated?
Well, thank you for having me. I would like to say that throughout the pandemic, we have been able to protect our patients who come to the hospital from catching COVID-19 at the hospital. So we have all of our infection disease precautions in place. But as you mentioned, we do know that we have some staff members who have been reluctant to get the vaccination, and I think that is because we are human beings and we're subject to some of the same forces. Those staff members at our hospitals are subject to some of the same forces and the same misinformation that's out there in social media and other sources. I think somehow the name of the vaccine, that they are mRNA vaccines, have driven some of that misinformation and some of that notion that this somehow gets into one's DNA and can affect the fertility of women. But we know, as Dr. Marty said, that that just simply isn't true. That even women who were part of the study originally of the vaccine, who were not pregnant when the study started and received the vaccine, got pregnant during their course of the time that they have been in the study. And we certainly have had women get pregnant since receiving the vaccine now. And as we know, there are lots of women who have had babies in our hospitals that have been vaccinated. And exactly as Dr. Marty said, we also know that we have patients in our hospital today who are pregnant and who are there being treated for COVID-19 infection, and their babies and their own lives are at risk because they were unvaccinated.
Or Dr. Johnson, rather, I'm so glad that you brought that up. That whole idea of this mRNA vaccine, a lot of people are saying, oh no, this is a new, different kind of vaccine. I'm worried about it. Let me turn things over to Dr. Perlyn here. Is there any justification or reasoning for that? How is this vaccine different from other vaccines that we've all been getting for years, that we've needed to go to school? What's the difference here?
Sure, that's a great question. And the mRNA vaccine is different than traditional vaccines, but there's nothing new about the science behind it. The researchers who have developed it have been working on this technology for years and years for many different things. That's one of the reasons why we were able to get this vaccine out so quickly, was because all of the groundwork had been set beforehand. The mRNA vaccine is different than some of the other vaccines, a polio vaccine or that type of vaccine. That's more similar to a Johnson & Johnson type vaccine with the one shot as compared to the Pfizer or Moderna type vaccines. But in our point of view, really, the goal is to get vaccinated. Find what people are comfortable with and get vaccinated. The CDC, the American Academy of Pediatrics, and we here at Nicklaus Children's recommend that all patients over the age of 12 without a pre-existing condition that would prohibit it or another specified exemption get vaccinated.
Dr. Perlyn, such important advice there. Of course, we want to keep you all here because we still have plenty more questions to ask you. We're going to go back to our important panel in just a few minutes. Coming up, we will ask the panel about the nasty Delta variant infecting our youth and what the doctors think about mask mandates in schools. We'll have much more on the pandemic in South Florida next.